Hello, and welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens. Thanks for bearing with me as we've had a bit of a hiatus. I did some travel with my family, did a couple of conferences, and I brought back a cold, so we may have some additional stops and starts here as I try to preserve my voice. But thanks for joining me. Today, in this podcast episode, I'm really excited to talk a little bit about a paper that got some copy recently in the press. So in Becker's Health IT, I saw this headline that really caught my attention. Does AI make clinicians more efficient? Not really, study says. And so I took a look at the article, which was just a quick summary of a paper in the New England Journal of Medicine AI, and went and grabbed the actual paper and did a read through. So despite what the Becker's headline says, the paper headline is a little bit more ambivalent. So the paper in the New England Journal of Medicine AI journal is called Does AI-Powered Clinical Documentation Enhance Clinician Efficiency? A longitudinal study. And this is interesting because it looks at a single health system. It's based out of Atrium Health, which is based out of Charlotte, North Carolina, where they used Nuance's Dragon Ambient Experience, or DAX, which is an artificial intelligence ambient clinical documentation tool. So like a lot of the other AI scribe tools we've discussed, you grab your phone, you gain consent from the patient, you push a button, the application will listen to the encounter, generate a draft note for you based on the encounter that it heard. You, the clinician, then get to review, edit, approve, and push into your electronic health record of choice. So this was interesting for a few reasons. One, they compared 112 primary care physicians with 103 primary care physicians. So 112 physicians used the tool, 103 didn't. So their groups were fairly evenly balanced. Of the group that was using the DAX tool, it's stratified into two groups. One was active users, so people who were using the tool to push about 25% or more of their notes into Epic from the tool. And then they had a second group of high users, so people who were using the tool to transfer more than 60% of their notes. So I thought this was really interesting because it's, I'm curious to know the factors that led to the clinicians using the tool for 25% of their encounters or less, right? I'm curious to know, were patients not consenting? Were the providers finding the workflow cumbersome? Was the tool maybe like I don't know. I'm very curious to see what the factors might have been that led to that stratification. The researchers found no statistically significant difference in EHR or financial metrics over 180 days when they tracked these providers using these tools. This is interesting because I went and I looked for publications from Atrium Health on their, just to see if they said anything publicly. They actually published a really nice article in October saying that they were using the platform and how really happy they were with it. That their clinicians said that it was easy to use, that they'd be disappointed if they couldn't access it anymore, that it improved the documentation experience. The paper looks at a few different EHR-based metrics of documentation efficiency, including time outside of work hours, the time that providers are spending preparing notes, the completed appointment rate, the same-day closure rate. They also looked at a couple of financial metrics. They looked at revenue per visit and they looked at RVUs. They also kept an eye on progress note length just to see if the tool was adding or subtracting, a significant amount of words per note. These are all really good metrics. I'm not surprised that they didn't find any statistical significance though, and I'll tell you why. When I looked at their methods, they're using an older version of the DAX tool, one that is not integrated into the electronic health record. So how this works is that if you're a provider, you're going in, you're doing your recording, and then you're looking at the note, and then you're pushing it into Epic, and you're doing all of the editing in Epic. So the only part of the workflow that's actually being kind of lifted is that generation of the initial note draft. And if you're a provider who's good with like smart forms or with note templates, you might already have that pretty much down. So I'm not surprised that they didn't see large gains in efficiency based on their Epic metrics. So a couple of things that you want to look at when you're looking at a study like this. And first of all, you always want to bear in mind, what's the rule for newspaper headlines? Is it Bettridge's law, right? Any headline that ends in a question mark can be answered by the word no. So when the paper asks, does AI-powered clinical documentation increase efficiency? Obviously, your gut instinct is to say, well, no. And then my gut instinct is to further ask, well, okay, why? And I thought this was an interesting intellectual exercise because I, right now, am a firm believer in the power of digital scribes to reduce the clinical documentation burden. I've been doing a lot of work with this during my day job. I'm really interested in measuring and quantifying the impact that these tools can have. So when I see this paper, I think two things. One, I think, this doesn't support my thesis, right? Let's dig in and see what we can find. And then two, what could this paper possibly say that would convince me otherwise, right? What evidence could this paper have that would convince me that this is not a good tool, that these tools cannot be effective? And so if this paper had measured, for example, the use of a fully integrated tool, if it had measured the use of a tool that was tuned for a specific specialty, I know the primary care tools are very effective. If they'd looked at this across multiple specialties, that might also have been convincing. It's not that the paper is bad. I want to be really clear about that. I think this is actually a really good paper, and the authors are very clear about the limitations of their study, about the limitations of their approach, given that they were using a non-integrated version of the tool. And they're very careful about how they set this up, right? In the discussion, they're very thoughtful about how they stage this. So they mentioned that the use of the DAX tool did indeed decrease markers of burnout among the clinicians, which is valuable in and of itself. They say really carefully that the hype for artificial intelligence tools has outpaced the evidence. And I cannot disagree with that, right? The marketing dialogue around the use of AI in general and digital scribe tools in particular is so high. The published research, they're right. It's really not there. And so the fact that people are publishing anything in this space is incredibly helpful to other health systems who might be making similar decisions. They also correctly identify that one of the main risks in the digital scribe space is that a health system is going to end up paying a large amount for a scribe tool without having a clear sense of what benefits they might see. And this was a way that this paper was fantastic, right? They mentioned that they did not see a significant decrease in the time that people were spending documenting in the chart. But they also said, hey, maybe they're using that time to respond to in-basket messages. Maybe they're using that time to prep for tomorrow's patients. You know, there's a lot of flux in the ways that that clinicians are using the electronic health record, and then the ways that they're choosing to manage their time that may not be easily translatable to strict dollars and cents. They call out in the end, and this is where I really do agree with them, that there is still potential for substantial time savings and burnout prevention with the use of these AI tools. So all in all, I think this paper was a good one. I think that the way it is covered in the press is a little bit misleading. So the conclusions from the paper are not that the tool is not useful. The conclusions from the paper are that we need more investigation, and we need to be more thoughtful about how providers are spending their time in the EHR that's not just doing note documentation. So I'm going to drop the link to the paper in the show notes. I will also link the original article that got me thinking. And thanks everybody for listening.